This is the Dental Up Podcast, your daily source for insights from dentists and leaders in the industry. Brought to you by Keating Dental Lab, a full-service, award-winning dental lab that is here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.
Please join me in welcoming to the Dental Up Podcast, Senior Technical Advisor here at Keating Dental Lab, Mr. Barry McGinnis.
Hello.
Hey, Barry, thanks for joining us today. This is going to be fun. I think it might be enlightening for some of our new dentists, especially listening. We've got a bunch of young dentists, new dentists listening. What we're going to do is we're going to talk about what a technical advisor for a large laboratory does. So why don't you just jump right in, Barry, and tell us what you do here at Keating Dental Lab.
Of course. Yeah, as the technical advisor in the fixed department, I'm mainly dealing with the fixed restoration cases. I evaluate the cases as they come in and determine any issues or problems we might have with the cases, and then figure out ways to resolve those issues and move forward with the cases. So I end up having to call doctors' offices, discuss it with them, and resolve those issues. That's pretty much the main duties that I have here. A lot of phone calls with doctors back and forth, but mainly it's evaluation, resolution, and moving forward, getting cases done.
Yeah. And you bring up a very important point, evaluation. That's what we do for every single case here in our laboratory. Right after the models are poured and articulated, it goes through the evaluation phase, and we're identifying any barriers to a successful outcome. And so that's really important because once we work on it and accept it, we own it. And we don't do that unless there's going to be a successful final outcome. So why don't you tell us what are some of the more common issues, technical issues that you find with crown and bridge cases?
Number one is probably interocclusal clearance issues. Just there not being enough space for us to fabricate the restoration. That's probably the main issue that we see. It's mostly under reduction. Those are the main issues. But the other things are draw, path of insertion issues. We end up with a lot of undercuts. Those are the main issues. And then it gets into just general impression problems, issues with sea of impressions.
That's a great point. That was always number one for me, is that if the impression doesn't look good, if it's not accurate, we need to put the brakes on the case right away.
Yeah.
Let's focus on that. Let's focus on the impression taking stage first. Margins, prep design, and distortion. Tell us what you're looking at exactly in the impression that's a red flag for you.
Well, first, we're looking for obvious things like bubbles or voids in the impression material. And then from there, we evaluate the light body wash impression material versus the heavy body and look at it just to make sure that they have the proper setting.
That's perfect because that leads to distortion, and that's going to be something that I want to talk about just a little bit more in detail. When I look at an impression and I flip it over and look at the intaglio of the prep, and I see all the light body is just pushed out into the vestibule and onto the lingual side or palatal side, I know something's wrong. I know that things were happening too slow. Chair side. And the materials aren't polymerizing together. The heavy body is essentially set. And it's such a dense, rigid material that the light body just squirts everywhere.
Squishes everywhere.
In
all directions.
Where you don't need it. Okay, I'm jumping ahead. Tell us what you're looking for with the light body specifically.
You just want to make sure that we don't see any bubbles or distortions there. You just want to make sure that it looks clean and clear. There's no pieces missing from it. Sometimes little pieces of impression material will get stuck in the mouth. So just those little minute details to it, especially around the preps and margins.
Yeah. And on the intaglio of the prep, I'm looking for specifically a uniform coating of light body. Because if there's areas where it's just heavy body, or I see that an entire axial wall is devoid of light body, what we do as technicians on the lab floor is we have to block that area out a little bit more. If it's a PFM, we use a little bit extra dye spacer right in that area. If it's a zirconia, sometimes we will just adjust the intaglio of the zirconia, either crown or framework, before we build porcelain on it.
Yeah, and most impressions we get from most offices are great. It's just those few that we have problems with. And a lot of times it seems it might get past the doctor's quality control somehow, and it ends up getting to us.
Yeah.
But most of the time, we're going to call and request a new impression in those situations.
So take us through the three options because we have three options that we give customers when we can't see the margins or there's obvious distortions on the prep. Why don't you walk us through the three options that we give the customers?
Yeah. The first one, of course, is to just re-impress and we can start over on it, start fresh.
And I think
Uh,
that's the safest option.
Yeah, it usually is. It's going to be the best bet, the most accurate way to do it. But the other options, we can try and do our best and have our dye trimmer who's really good at it, do our best at it and proceed. But unfortunately, we most likely would not be able to guarantee it in that situation.
So those cases are typically fabricated under what we call the no guarantee or no warranty status.
Yeah, we don't like to do that. We will when doctors
Right.
request it.
And there's a lot of patients that can't get back in, or the
Yeah.
doctor knows that there was a struggle even getting to that level of clarity in the impression. And we're perfectly fine doing it if that's what they wish. We'll obviously comply.
And other options for that, I'm drawing a blank right now.
Usually what we'll do is we'll ask the doctor if they want to inspect the model and
Yeah,
if they can
yeah.
dye trim the case
Dye
for
trim.
us.
That's right. Yeah, we return it, let them evaluate it, and possibly dye trim it if they're able to. That would probably be the third option. Yeah.
Okay, so let's go back to the issue of lack of interocclusal clearance and preparations that are under reduced. Tell everybody what our rules here are for layered ceramics versus monolithic material and how much room we need for each type.
Yeah. For the layered ceramics like PFMs or EMAX, we do request 1.5 millimeters of clearance.
That's the minimum, right?
Yeah, that's the minimum. And most of the time we do get that, but we'll end up with one little area where it's just one spot that's closer. That's just a little bit less, which normally isn't that big of a deal. We can make a small adjustment to the opposing. But yeah, 1.5 millimeters for layered restorations. For the zirconia restorations, the monolithics, we'd like to get at least a millimeter. That's pretty much the minimal thickness for that material. And for full cast, for metal restorations, we can get down to about a half millimeter thickness.
That's right. And
Yep.
again, those are the minimums. I tell customers, especially young dentists, if you want a restoration back that really looks like a tooth,
Yeah.
strive for 2 millimeters because then we can make really nice occlusal anatomy and give the restoration some depth. We can recreate natural human anatomy in that case. But
Yeah.
at 1.5, we're a little bit limited. It usually looks a little bit flat,
Yeah.
cakey, chalky on the occlusal surface, but we can certainly do it. And we probably do 100 restorations a day that have 1.5 millimeter
Yeah.
occlusal reduction.
Yeah, it's not ideal. We can definitely make a more aesthetic restoration with more clearance than that, more natural, more lifelike looking. So it's going to match better to the adjacent teeth. The thicker we can make the material, the more aesthetic it's going to be.
Definitely.
Yeah.
So do you have any tips for young dentists on what they can do to check interocclusal clearance in the mouth and make sure they've got enough?
Yeah, clearance tabs. Use all those clearance tabs. I don't know exactly which companies are offering those disposable ones, but I think those are probably the best option, the little one-time use clearance tabs. And yeah, just double check it, triple check it, maybe inspect the impression. Yeah, I think just clearance tabs and then just being aware of what they're prepping, what final restoration is going to be made.
That's great advice. Prep with the final material type in mind.
Yeah.
Um,
Yeah.
because some obviously will require more reduction than others,
Yeah.
as we've just noted.
Yeah. And the other thing for the draw issues, I know the reverse prep technique is it solves that problem, going with the reverse prep technique.
I always tell customers, just don't angle that burr tip back into the long axis of the tooth.
Yeah.
Keep it nice and parallel and a steady hand going all the
Yep.
way around. Yeah, we see a lot of undercuts even on single units. And I think that happens from taking old restorations off, making the margins deeper. The natural tooth obviously constricts, narrows down at the CEJ anyway. So yeah, you just wind up prepping an undercut and the restoration can't get over that big belly that's in the middle third of the prep. Okay, so let's go back to reduction and now specifically for anterior restorations. It fits right back in with what you said, prepping for the correct type of material. Okay, so we get cases returned from customers and kind of three broad categories I put them into: margins and fit, contacts, and then color. And we get the anteriors that come back. The first thing I do, and you know it, but the first thing I do is I pull out my calipers and I check the facial thickness of the restoration.
Yeah.
Tell us some of the issues or conversations you've had with customers where there's a lack of facial reduction, specifically as it relates to the parameter of.
I do try to tell doctors to give us as much facial reduction as possible because these are the most aesthetic restorations that we're doing in the aesthetic zone. So the more that they can cut it back, the better it's going to look, the more natural it's going to look. But yeah, especially if we're doing all ceramics, the thicker the material, the better it's going to turn out, the happier the patient's going to be.
And this goes back to our point earlier on layered ceramics. Emax layered, KDZ Ultra, which is porcelain fuses zirconia, and PFM in the anterior, particularly on the facial axial wall, 2 millimeters reduction will yield a final restoration that has the appropriate color, matches the shade.
Yeah.
And also has a nice 3-dimensional look to it.
Yeah. Yeah. Yep. And the shade is going to look better. It'll be a better overall shade match than with the thicker material. And most of our doctors are great and they do give us plenty of reduction and they give us what we request from them. But there's some every now and then.
They're tough cases. They're cases where probably the tooth preoperatively was outside of the
arch form.
The arch form. And they're trying to do instant ortho, but hey, there's a nerve in there and you don't want to do a root canal also. The first thing I check when restorations come back, and typically the conversation goes something like, the restoration was a little bit opaque and dense looking. And when I put the calipers on and it's either KDZ Ultra or PFM and it's only a millimeter, I go back and I say, this can't be a 5 powder buildup crown with a millimeter. And we've got either 2 to 3/10 of metal and opaque, or if it's zirconia, we have 3/10 of a zirconia coping. And then you're trying to fit in at minimum, you're trying to fit in 3 layers of porcelain in the remaining 7/10. And
there's just not space.
Yeah, there's just not space. And sometimes the porcelain is so thin, what happens is the light is passing through a thin layer of porcelain and it's reflecting off of a very dense, opaque structure, like the opaque layer or the core. And then I recommend Emax because Emax at a millimeter of final thickness does tend to look pretty good.
Yeah. The Emax still look great when they're thinner, but they are a lot more translucent. So those underlying tooth colors are going to show through those a lot more. They do affect the final shade a lot more.
That's a great point. Stump colors, providing prep colors for us is vital when the restoration is going to be thin.
Yeah, we still get a lot of cases for translucent Emax and translucent zirconia where a stump shade is not provided. So that's another one that I call often for stump shades or final shades.
It's on the prescription. And I think a lot of times that final color is final color and how we get there is not always the same path. If we know the stump color versus if we guess.
Yeah, it makes it a lot easier when we know that stump color, and it's gonna minimize the chance of that case coming back for any type of shaded.
Absolutely. I've had lots of conversations with customers. There's 3 variables that we need. We need the prep color or stump. We need the cementing medium. There's a color to that. And then we've got the color of the piece of glass. 3 play a role in final color. So if we're only controlling one of the 3 variables, then the other 2 sometimes will lead us to an inferior result.
Yeah. Because a lot of times we don't know what that is or what they're using and what it looks like.
One of the most important functions of your job, and I know you do this really well, is case consultation on large, or let's just say anterior cosmetic cases. Can you walk us through a recent case that started off with a phone call and maybe just study models and then progressed through a wax up and then the final successful outcome?
We do quite a few of those cases that are large, full arches or even full mouth reconstructions that start with a phone call from a doctor. We discuss the plan and how to go about it. It usually does start with a diagnostic wax up. The doctors will get us preliminary impressions, provisional impressions or scans, and then we'll do a preliminary diagnostic wax with that for the doctor to show the patients. And then from there, once the doctor's got his prepping done, they'll send it to us. Normally, doctors will want us to copy or loosely copy the diagnostic wax up, which we can always do as long as that model is sent back with the case.
I also tell them that if they're making the provisionals directly from the wax up, take a quick alginate of the provisionals in the mouth. It's actually it's more accurate. That's more accurate than sending the wax up back.
Yeah.
Especially if they've had to make any changes to either length, BDO,
Which
or
happens often. Yeah.
it does. Yeah.
Yeah.
And an overbite overjet relationship as well. Sometimes we'll make the wax up and there will be too much overjet in the mouth and the dentist will have to correct that. And if they just send the wax up model back, then we're repeating that essentially in the final restoration.
Yeah. Yeah. We don't know about the changes that have been made with the temps.
Yeah.
Yeah, we do quite a few of those, and I feel like we have a great success rate with those. I don't see a lot of those coming back. But again, one of the things that I recommend doctors when doing those big cases like that is to take full arch upper and lower impressions at the very beginning before doing anything and just save those models. Save those pre-op models so that vertical can always be referred back to if needed, or the teeth can be referred back to if needed. But that's always a good way to start with just full arch. They can be PBS or alginate. PBS is probably better for that. But yeah, I always recommend taking those full arches before starting anything, before we even get to the diagnostic wax up stage.
Absolutely. It's the contractor going in to a job site and you've got the plans. You need to see what's there, what's existing.
Yes.
And you don't want to lose that reference point.
Yes.
We do a lot of these cases, the full arch or full mouth cases, we're obviously restoring in CR, but a lot of cases where they want to keep the existing vertical and it's only 6 teeth or 8 teeth or anything. So we can't change the entire dentition. We do have to maintain the vertical. So it's nice to have those models where we're not going to lose our reference point. Tell us, what's your favorite material out of all the restorations we made?
Since the beginning of my career, I've always been working with TFMs. I've only worked with zirconia the last not even 10 years, but I want to say zirconia. I think zirconia is probably my favorite right now. If I needed restorations myself in the posterior, I would probably want zirconia. And in the anterior, I probably want Emax or maybe some ultras. But I would say, I think zirconia is my favorite material right now.
Yeah, mine too. You bring up a good point. It depends on the location of the mouth for sure. But posterior, go monolithic in strength. And even our Bruxer aesthetic is literally double the strength of Emax. And I have a hard time know the difference. I see about 200, 300 of them a day.
Yeah.
But there's cases I'm looking on the back shipping cart and I have to pull the work ticket out. I was like, wow, these look really good. And it's not Emax, it's Bruxer aesthetic.
Yeah. A lot of the Bruxer aesthetic crowns, they come out looking beautiful. And I don't know if the zirconia pucks, the manufacturers have improved them over the years, but yeah, the Bruxer aesthetics, they look great. They look really great. I would definitely get Bruxer aesthetics in my posterior. If I need restorations, I'm thinking more towards strength and longevity. I don't really care as much about the aesthetic. So yeah, I would say,
you're already married. Exactly. You're done, man.
Yeah, exactly. Yeah, but zirconia, I think zirconia is the future still.
Oh, absolutely. And the materials are getting better.
Yeah.
We did choose, and you were here for that. We did choose when we milled probably 7 or 8 different vendors, brands of zirconia for the KDZ Bruxer aesthetic. We finished sets of restorations and that taste test challenge, if you will.
Yeah.
I mean, we settled on the KDZ Bruxer aesthetic and it's been brilliant ever since.
I think it's great. I think it's a great product.
Yeah.
We get a lot of doctors prescribing it too.
Oh, absolutely.
Yeah.
And there's a trick that not a lot of them know about, but it doesn't have to be monolithic. We can actually do a little micro cutback and layer it on the facial just to jazz it up a little bit. And you've got that translucent core of zirconia and the Noritake CZR porcelain bonds to it perfectly well. And they look really nice.
Yeah, I think you're right though. I think that a lot of doctors aren't aware of it because I get that question a lot. We make a monolithic crown and a doctor tries it in and may need to add a small contact. They'll call and say, I have this open contact. Can you remake it and overbuild the contact? And I say, if you return the crown, we can just add to it. And they're usually surprised by that.
Yeah.
They don't realize that we are able to add. And again, I tell them it's just small amounts. So we can add just small amounts.
And it's not in a load bearing area that's going to fracture.
Yeah, exactly. Yeah. These are in contact areas where it's not crucial contact point.
Exactly.
Yeah.
If we miss and we have to add a working cuss tip, we're redesigning and remilling that.
Yeah, exactly. Yeah, but a lot of doctors, I think they're not aware of that we are able to just add small amounts to them.
The Noritake CZR porcelain is wonderful.
Yeah.
And it's the most aesthetic porcelain that we've ever worked with. And the technicians love it for its vitality, but it also bonds extremely well to zirconia.
Yeah, it does. Yeah. And it's a strong porcelain. It's great.
Hey, thank you so much for your time. I know it's Friday afternoon and we got to get rolling and we got cases to QC
Yeah, we got work to
and
do.
yep, clients to call back. But I want to thank you for your time. I want to thank you for your many years of service to
Yeah.
Keating Dental Lab. We can't out on the lab floor. We can't do this job without you, and we really appreciate you.
I appreciate that, and I appreciate you having me on.
Awesome. Hey, thank you so much. And yeah, let's get back to work.
Thank you for listening to the Dental Up podcast, your daily source for insights from dentists and leaders in the industry. This episode is sponsored by Keating Dental Lab, here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.